Hi, I'm Fatimah Syed. I'm a family medicine doctor and at present I practice at Brentwood Family Medicine, and I'm part of the TriStar Family Medicine residency program as well. I was born in Malaysia, and most of my early childhood was in Malaysia, and I wanted to become a doctor. It was my father's childhood dream that was unmet, and he decided that he's going to inspire all his children to be doctors. So, from as young as I know, he was the one who inspired me to be a doctor. He said that to be a good doctor, you just need yourself and your capabilities, and you can do wonders to people, and that inspired me a lot, and I wanted to be a doctor ever since I was a child. My patient care philosophy is to be a scientist and an artist in one form. What I mean by that is that although I'm a trained doctor, I know a lot about medicine and science. I also feel like I must be a human and an artist in the room when I'm meeting the patient. By that, I mean that I have to translate what I want the patient's goodness to be in a very actionable plan. And that happens when you meet them at where they are and understand with empathy what they're going through. And that gives me an idea of how I should be able to translate my plan for the well-being in an actionable way for the patient. I think there's a big need for um, people being supported in the challenges of life, and because we have so much information and there is so much competition and challenges and so much that is expected of each other, I think somewhere between being patient and letting ourselves to develop, there is so much of anxiety, and I think the younger people are under so much pressure, and I think mental health is one area that I'm very passionate, especially with younger adults. I'm very passionate about that to become better at how to be able to support them. With my being a physician, I feel like developing doctors, medical students actually are my biggest passion, because that's where the biggest impact comes. So, and when I'm with a student, I'm when because of my growth through them, they also grow through me. I think it's a symbiotic relationship, and I'm very much invested in my own growth and my own learning. And I feel like when I teach, I learn, and that's how even today, I'm not comfortable with how much I know. I always keep learning, and I also teach. So when a patient comes to see me, I hope they will take from me is that this is a doctor who really cares for them. As cliche as it may sound, I think not all of us are able to solve every problem for a patient, but the fact that they found a doctor that will truly care for them and be a part of their journey as a physician, as a scientist, as a human being. So they'll always have a place to come and find the best person to be there for them.